Classification of disabilities by World Health Organization 1996. The first one is impairment. Impairment is a loss or abnormality of a body function that can be anatomical, physiological, or psychological. Refers to a problem with a structure or organ of the body. Examples of impairment: impairment in language, vision, or memory loss, hearing, skeletal, and psychological.
Disability refers to the limitations or lack of ability to perform activities that a normal person can do. Disability is a result of impairment that might be present at birth or a cause of an accident. Disability has a wide range of variations that has different needs and approach.
World Health Organization of 1996 also clarifies the term handicap as a problem encountered during interaction with the environment. Also, according to the International Clarification of Impairments, Disabilities and Handicaps (ICIDH), handicap is more problematical. The items are not classified according to the individuals or their attributes, but rather according to the circumstances in which people with disabilities are likely to find themselves. Circumstances that can be expected to place such individuals at a disadvantage in relation to their peers when viewed from the norms of the society. Examples of handicaps is orientation, mobility, and social integration.
The origin of handicap is a lottery game called Hand in Cup, which was played in the 1600s. Basically, the bartered game involved putting forfeit money into a cup and the owner of the less valuable item has to pay up. The term then evolved to hand-e-cup, which became handicap. Over time, handicap was linked to equity as it was commonly used in sports to make a certain competition fairer. The term became widely understood as a way or condition to limit or impede.
The World Health Organization defines a handicapped person to have a loss or limited opportunities in being involved in activities as compared to the majority of the population. It focuses on an obstacle experienced by a person due to a restriction in the environment. A handicap is a disadvantage resulting from impairment or disability that limits the social role of an individual and being unable to work somewhere due to limited access.
Handicap may be a congenital or acquired as a result of injury or disease, especially to the nervous or musculoskeletal system. A disadvantage for a given individual that limits or prevents the fulfillment of a rule, and who has some condition that markedly restrict their ability to function physically, mentally, or socially. It preventing or restricting a person from participating in normal life.
Students of all disabilities and backgrounds want classrooms that are inclusive and convey respect. For those students with disabilities, the classroom setting may present certain challenges that need accommodation and consideration. Here are some strategies to use. Don't assume what students can or cannot do with regards to participating in classroom activities. Think of multiple ways students may be able to participate without feeling excluded. Make instructional materials available in text form. When in doubt about how to assist the student, ask him or her as privately as possible without drawing attention to the student or the disability.
We must keep an organized environment. Establishing an organized classroom will allow students to be concentrated with no unnecessary structure attached. Also, we must remember that every student is special. Know that every student learns differently. Let them explore the subject in different ways. Another thing is, create success opportunities. Special needs students sometimes believe like they have difficulty in succeeding. So as a teacher, it is a must to create a chance to recognize their progress throughout the lessons and celebrate it no matter how it is, so that they feel motivated and can lead to have a positive outcome.
Teaching handicapped students will present us with some unique and distinctive challenges. They require specialized instructional strategies that supports and enhances their learning potential. Remember that teaching handicapped students are not incapacitated or unable to learn. They just need different instruction aligned to their learning abilities. Here are some strategies to teach and handle handicapped students. First, provide an instructional video. Second, encourage them to cooperate in learning activities when possible. Third, create an atmosphere in which true community of learners is facilitated and enhanced.